Welcome to the University of Pittsburgh's Health and Explainable AI podcast. I'm your host, Jordan Gass-Poore, a health and science reporter. Join me as we cover advancements being made in health informatics and explainable AI for students, researchers, and healthcare practitioners interested in applications of artificial intelligence and machine learning. This podcast is produced by the University of Pittsburgh's Health and Explainable AI Research Laboratory at the University of Pittsburgh School of Health and Rehabilitation Sciences Department of Health Information Management. Headed by Ahmad Tafti, Pitt's HexAI Lab cultivates extramural collaborations with academic institutions both nationally and internationally through its research, educational contributions, and this podcast series. Hello, and welcome back to Pitt HexAI, a podcast series produced by the University of Pittsburgh's Health and Explainable AI Research Laboratory. I'm Jordan Gass-Poore, your host, and today we're going to speak with Beth Bauer. She's CEO of PosiROI, co-founder and CEO of Communities Connected, and VP of the DataJam. She's also the Global Board Co-Chair of Program and Projects and Regional Co-Lead for the Healthcare Businesswomen Association's Women in Healthcare Giveback Affinity Group. Welcome, Beth. To get us started, would you like to introduce yourself and tell us a little bit more about your different affiliations?
Well, first of all, it's so great to meet you today, and thank you so much for this opportunity. So my background is odd transitional journey. I originally wanted to be a psychiatrist and go into the area of medicine. But when I actually did an internship in the Western Psychiatric Institute a million years ago, I realized that that wasn't quite the journey for me. And so I continued down the pathway of psychology and journalism, actually, but then realized that I was just missing something, and it was the math. And I was very blessed to have studied under Dr. Steven Feinberg at Carnegie Mellon University, who was like the Indiana Jones of statistics. And he just lit a fire of what could be revealed by looking at data. That ended up that as I graduated with a bachelor's degree in psychology, professional writing, and a minor in statistics, that I landed in the Robert Wood Johnson Foundation, which is the US's largest healthcare foundation in Princeton, New Jersey, in an area that they were just beginning to look at health statistics. And I was blessed again with the opportunity, interesting for an AI discussion. My job was to find out the health of the nation, and I actually needed to dig through stacks of the MMWR report, photocopying data, which would then be placed into a database for us to be able to understand the health of the nation. The point of that was to be able to put a focus and dollars and resources to our largest problems. Simultaneous to that, I ended up going on for a master's degree in statistics at Rutgers University, but realized that the pace of the work that I was doing there just didn't lend itself to me. I ended up going into commercial health through a company called IMS, which is now called IQVIA. And it is the nation's and probably the world's largest commercial healthcare database. Playing a variety of roles throughout that, ended up, this is before we had the words data science or AI, was calling myself a data detective, right? How we were able to find out new ways of addressing health through data. That led me through a whole variety of roles, from the end to end of some of the world's largest, most holistic databases, tying in 1,500 different data sources into one harmonized system that could then feed industries on the commercial side of being able to understand how to impact health better and how to be able to get that information and insights out to people in the commercialization of that. I was then it's a fascinating space to have built an entire, with teams obviously, data system, and then be my own customer, right? So now I had to be on both ends of that spectrum, understanding how to build these systems in detail, providing all of that rigor. And then how do you use that information to actually make impact in the commercial side, but for the benefit of patient health? That then led me to understanding two sides of that, the pharmaceutical and medicine and med device side of that industry, having to understand the entirety of the healthcare system in order to make that happen. And then going and supporting in a whole other suite of benchmarking in the pharmacy retailer space, which is absolutely enlightening, because one side is very therapeutically oriented, the other side is very patient oriented. And so how do you begin to tie in all of this information that actually improves patient health? That led me to my most recent commercial role, which was the Merck's US commercial data strategy leader, which encompassed data strategy, management, innovation, and enablement on the commercial side, which then led me to realize, in order to get more people leveraging these insights and really make an impact on patient health, we need to be getting people along the continuum more open and enabled and empowered to think about how they can leverage data in an informed way within context, fit for purpose, so that we can all be comfortable about the journey that we're going on. Because as I look back reflectively on my 35-year career, the number one thing that comes out time and time again is having to build trust along the way through the analytics. Health Explainable AI, right? Who's hosting this podcast? That's it in a nutshell. If you can't explain the journey that you've been on, it's very hard for humans and machines, in some cases, to trust in the innovations that you're bringing forward. So bringing people with data so that we can actually have shared decisions.
You mentioned statistics. I get a little sweaty. I took one statistics class and it completely turned me off of statistics. However, I will say this positively about statistics, though, is as I go about my journalism career, understanding the importance of statistics and data in general, and how important it is to be able to communicate data effectively to the layperson, and how speaking with enough professionals and medical professionals, how rare that is and how difficult it is to be able to communicate that effectively. So with all of that, I'm curious to get some of your advice on how to be able to communicate that data, and especially health data, effectively to regular everyday people. I can learn from this.
Well, I'm going to take one step backward. I actually saw a post on LinkedIn where a medical doctor in a high-up institution shared a statistical exam by his nephew, who was at some elite institution, and shared this on LinkedIn saying, "Oh my goodness, I would never be able to pass this test. This is impossible. You know, I don't know how my nephew was able to do it." And I looked at the test, and the test was written in the language of math. This man was a doctor. Clearly, he understood statistics when it comes to medicine. And in fact, I work with another person who's actually a fashion designer who went to MBA school and had the same thing, was faced with an exam that was written in the language of math. In all of these instances, as soon as we can translate the math into the subject area, suddenly it all becomes simple, because we understand how different things interact with each other, how they relate with each other, but not everyone speaks the language of math. So if we can actually take this from it down to people into their daily lives, and how the concepts of statistics actually weigh into how they even think or see the world, suddenly it becomes easy. It becomes eye-opening, because you don't necessarily have to need to understand every piece of the math to understand the concept of statistics. You just need it to do the calculations. But quite frankly, in a lot of today's world, we can even use computers for that, hopefully with some humans doing the extra checking, right? There always needs to be a combination of humans and AI in the loop to do that validation. But when we can bring those concepts simplistically into what it means to the individual, suddenly they get it.
No, completely. I mean, I understand though that, there are some challenges in being able to do what you just described and to be able to bring that data to communities. And I'd love to talk a little bit about maybe some of those challenges in bringing the data to communities.
So probably the biggest challenge that I've seen, it really doesn't matter whether we're talking about local communities or executives in a business, in a Fortune 300 company. If they haven't come along on the journey of how you got to where you're headed, then they put up barriers. So we can see easily, each time any of us is presented with something that is really game changing. It can even be medicines that potentially, or techniques that could save our lives. Our first reaction usually is, well, if it's so obvious, or if this was an easy pathway, why didn't we know it before? How could it be that your answer today is actually so game changing? And so there usually are, in the analytic process of coming to an innovation, there are a series of milestones along the way that we learn and leverage and step on to be able to move to gain these insights, or we create nuggets, and then these nuggets get connected together, which lead us to a variety of new science techniques. And then potentially we leverage the scientific method to wean out what's working, what isn't working. And we're great at discussing that within our analytic spaces, or the super experts within that area. But each time, if we can actually leverage the language of the people who we're trying to communicate with, we can actually begin to overcome some of those initial barriers. Because if we use jargon, and sometimes we don't even realize we're using jargon, it actually creates a difference between you and me. I'm laughing because there's actually an AI technique that Will I Am from the Black Eyed Peas is working on right now, that is leveraging responses about AI in the language of the neighborhood he grew up in. I don't remember the name of that language, but it talks like in a hip hoppy kind of way, responding to people. And when that comes back in their language and they can understand what that means because it's the way that they speak, suddenly this isn't as scary anymore. And you can begin to actually break down the barriers between two groups by being vulnerable and asking questions. I mean, as we all know in the whole AI space, your AI and your responses of AI and your successes are only as good as the questions that you can ask of it. And so creating an openness within a community, that psychological safety, which starts with our language to each other, that we can begin to actually break down those barriers and have people pause to listen to the first thing you have to say. Because if barriers go up right away, no matter what you say next, it's not heard. So to be in a space where you can communicate clearly with each other and honestly and transparently, and sometimes transparently is being proactive in your transparency, you can begin to actually build that first trust base that allows their mindset to be open to what you're going to share.
Definitely. I mean, and thinking, that I had thought for a long time as I was going through journalism school about how data was this sort of inhuman, and the only people that had access to it were specific gatekeepers, and that it was hard to access for a community or for regular everyday people. And, thinking about data as really being not something cold and inhuman, and not just, that each person represents a number, but that data is people. And I think keeping that in mind, I think is really important. And with all of that, I'd love to find out though how you can sharing with us about your idea about this people-centric data-informed culture and like what that might look like, because I think that might help answer or alleviate some of my fears of data being this inhuman glob, and that the people who have control over the data don't necessarily care or see me as a person.
So I love everything that you just said. And one of the largest insights that I have learned is that the word data means something different to every human on the planet. And every human on the planet, I don't care where they are, even if they're in remote fields in Africa, is using data in some way. And that data could be something like, I know what time the sun rises and sets. I know when my seasons are. I know what crops to plant when. I know what my community's likes and dislikes are. I know how my spouse reacts to, different conversations. All of this is data. Data, in my mind, is equitable to knowledge and is equitable to feedback. So what data ultimately is then is we have prioritized certain knowledge and feedback to be digitized into something because we think that that's an important thing to understand. And then the big data end of that is how do we begin to integrate all this digitized knowledge into being able to understand and then provide feedback back to the various intersecting, influencing ecosystems? Because all of it is various ecosystems influencing each other, which starts to get really big and make people crazy if I start talking about the bigness of all those things. And it's super cool because today's technology with knowledge graphs and large language models and small language models and RAGs, there's all this opportunity now to actually begin to put those overlapping ecosystems into a way that when we have a particular context that we're interested in understanding, we can dive into that context, go deep on a subject, and then we can actually, in a multi-dimensional way, dive into that context in a way to see, when I hit this lever in this way, what alternate things happen? So for example, if we're talking about various kinds of incentives, I don't care whether they're commercial or climate or, whatever kind of incentives you talk about. If we only create, say, one metric of incentive, we push on something really hard in one direction, and it's almost like Newton's cradle. You have a power move and it sends something else moving out of kilter on another end. When we have the complexity of, say, an integrated knowledge system, we might not be able to see everything that potentially is impacted by that, the butterfly effect, if you will, but we should be able to see some of the largest impacts that would happen. A simple example that I can share is in working with pharmacy retailers who were very interested in improving medication adherence for patients. There were multiple teams within these spaces. One team is, how do we get more patients to come to our organization to fill their prescriptions? Another team was, how do I make sure that I hit certain medication adherence numbers? Well, when you start to dive into these two topics, you start to realize that brand new patients in a particular medical space who are new to this therapy, and even more so any chronic therapy, are very much non-adherent. So the two goals of having a bring new patients in and hitting medication adherence are actually in conflict with each other. So it's not until you can begin to separate these two goals to say, okay, let's look at the medication adherence of new patients differently than the medication adherence of returning patients or patients 6 months into their therapy, because they're going to need different actions and they're going to need different, they personally have different needs, and we have to provide different needs to be able to serve them appropriately. So beginning to understand that there are always conflicting goals, and how do you want to be able to balance them by providing multiple metrics, not just one on an outcome.
But I understand you do work a lot with students, and it's really important on this podcast that, trying to get the student population, we really want those student ears to listen to the show and our conversations. And so for any students that are listening to this conversation right now, curious if you have any student research project ideas that students can take notes on and we might see materialize in the future.
Yeah, thank you so much for that question. So tying in a degree to what we just talked about on medication adherence and the overall concepts of conflicting goals and insights, it would be incredible to have students working on a variety of topics that within healthcare, what are some of the insights that we can bring to patients and communities so that they can understand how combination of their communities' social determinants and belief systems and the outcomes of the commercial groups who benefit from that tie together so that they could work together to be able to improve outcomes for health and eventually wealth. Because at the end of the day, health and wealth are very much tied together for everyone. That's one piece that we don't really hear people talk about, is that a healthy community breeds a healthy commercial community and vice versa. So being able to tie together the value propositions of improving health to both the community members as well as the community stakeholders.
Unlock the future of AI at Pitt HexAI. Pitt HexAI is where the brightest minds at the University of Pittsburgh come together to push the boundaries of artificial intelligence. Tune into the Pitt HexAI podcast to hear experts discuss cutting-edge AI research and its real-world impact. Join us at Pitt HexAI and listen to the podcast today.
Fantastic. On a similar line with the work that you've done with students, that I understand that you recently came back from an event and you had mentioned the DataJam, and I'd love to hear a little bit more about what DataJam is and about your experiences with students.
So the DataJam is near and dear to my heart. It's an organization that started in Pittsburgh with a public-private partnership between the University of Pittsburgh, Carnegie Mellon University, IBM, PPG, and a variety of other stakeholders in that area. 10 years ago, they realized there's no way that we're going to have enough data scientists to be able to handle the data needs of the future. So they started a program with just a few high schools in Pittsburgh, and the purpose was to get students in high school excited about working with data. And what does that even mean? Because as we talked about a little bit ago, like, what is data? We don't teach data for the most part anywhere. High school level, university level, like, we don't teach about the variety of how data, big and small, can inform decision making. Quite frankly, we don't even talk about decision making unless you go into data science, right? So this is an area where a lot of people need a better understanding of how do you formulate a question, no matter how big. How do you then begin to think about how you could collect data around that? And then potentially, as you find out what data is available and usable, how you may need to evolve your question to begin to find the smaller nuggets that lead you down this pathway to actually having an understanding of your world. So this competition is a high school team competition, which over the 10 years has now evolved to, I think we're probably going to exceed about 45 high schools this year. It started in Pittsburgh, spread across Pennsylvania. We've now accumulated teams in New Jersey, Massachusetts, California, potentially Arizona, and additional universities have begun to tie in. Caldwell University in New Jersey, Northeastern, I think, is looking at it in the Boston area. UCSD and UCSF are now teaming up on this overall project. What's super exciting about it is there's a second level to this. So those universities that I just mentioned are offering mentor programs, which actually train whoever's interested from a variety of different, both data, computational sciences, or just sciences in general, to learn how to be mentors. So if we were talking about the variety of jargon, what that can also mean is principal consulting in an industry language of how to guide teams of non-technical people to form a question so that they actually can begin to use data to inform what they know about their world. What's been fascinating about this is we don't tell those students what to look at. So their interests actually create what their questions are. And realizing, data makes up health. That's a big part, obviously, a whole variety of topics on health, which are inconceivable to people who are outside health. But it also informs social interactions. It also informs history, our understanding of history. Like, every topic of the day uses data in some way. And so these skills and this way to use data to inform that decision making are just golden. So we train these mentors who then function, they're assigned to each of the high school teams who also have their coach from the teacher in the high school, which forms a tiered approach because, again, high school students, if they hear a teacher speaking, it might sound a lot like wah, wah, wah. When they hear a peer speaking, it sounds like, oh my God, I got to get up my game. So that is the fantastic news on the DataJam. And we are at a level now where we're expanding like crazy. And a huge part of that is beginning to actually tie in more corporate organizations to realize if you want to fuel your talent pipeline, you need to make high school students aware of what it is that you do. So we've been asking a variety of different partners. It's probably over-indexed on health organizations because of my background, but we went to go visit the Gates Medical Research Institute in Cambridge. And that organization, their main goal is actually, they are a nonprofit separate from the standard Bill and Melinda Gates Foundation that is dedicated to developing the effective use of novel biomedical interventions that address substantial global health concerns for which investment incentives are limited. So what does that mean? When it is not necessarily an area that is going to have high commercial viability, they then spend the research dollars to make sure that that research still happens, because we live in a capitalist society and research goes where the money is. And sometimes we need research in areas where there isn't as much money. So they're helping to make that happen. It's kind of the preclinical area of what a medicine company would be. And then they're passing that off to someone else for commercialization once they get to a certain point. So they were kind enough to have, we had a Brook Charter High School out of Boston who came for this visit. We broke out into sessions that were talking about the from the CMC or chemical manufacturing, quality checks, etc., from drug discovery, commercialization, and then post-commercialization, making sure that patients continue to be healthy. We had these different stations. Students broke out with the actual data scientists, and oh my goodness, we were supposed to switch stations every 10 minutes. They were so deep in conversation. I maybe forced one switch, and then we had to just call it quits because it was so engaging for students to see the actual tools that data scientists work with, the kinds of questions that they deal with, and the variety of needs on data and AI across the continuum of any organization, particularly a medicine company. It was just absolutely outstanding. And then they get to see themselves in this environment. What would it be like for me to be working here? What kinds of things would I do? And when you meet, data sounds so boring, right? Everybody thinks data and statistics is boring. But actually, when you meet impassioned people who love what they do, it creates excitement in the young people. So we are so grateful at the DataJam for the visit to the Gates Medical Research Institute. For me, the highlight of the day, as we approached the end of the day, one of the students who was so quiet when we first started turned to the woman who put this all together for us and said, "So this tour is just something you do, right?" And she's like, "No, we've never done this before." And for that student to hear, she just beamed, recognizing that she is doing something groundbreaking herself, right? By being in this program, that created a means for someone to now go to a place like the Gates Medical Research Institute.
I think that's a great compliment. Also, I came from a small town in Texas, and I would say, frankly, like I would have appreciated very much if there would be a program like this or a summit or a tour visit or something to see that.
Well, and that's one of the big findings in general that I tie into both for the DataJam and Communities Connected is we have the people we need right in our communities. We just have to talk to them. So how can you back to when we first all got on, the bridges, how can we leverage these bridges to bring people together talking to solve common problems? Because at the end of the day, we're all humans trying to live on this planet together, suffering a lot of the same issues. And we don't hear each other. So to bring people from various communities into the same room and be able to talk, and from potentially one characteristic of the communities connect is it is actually having communities with similar issues who may be very far geographically from each other to talk together so that they're not hearing about the trust in the AI and insights from experts. They're hearing it from other community members who they might not have otherwise had access to.
So Beth, on our podcast, we really like to focus on explainable AI. So would love your take on explainability. What is explainability to you?
That is a fantastic question. And the answer is just like I'm going to say, all data is within context. And so it depends on who you're talking to. In any communication or public speaking that you could take, it's always understand your audience. And the same is true with the health explainable AI or any explainable AI. You have to have an understanding of who it is that you're communicating with, use their language, and then have some kind of understanding of when you first meet with them, that you are meeting them where they are, and you are able to then walk them from where they are through the journey of dot connection, insight connection, human relationships, storytelling that allows them to come to the place of where you've landed with the AI. Nobody likes the concept of black box AI. And what I personally have found is that even within black box AI, usually if you dig into that, there's a whole series of little nuggets that actually do provide the explaining, but that requires a whole other level of work and understanding, communication of cross-functional feedback with technologists, subject matter experts, whoever is setting those goals, the variety of things that you're looking at, bringing them together to tie them to the human concepts that actually allow us to understand what that black box is really doing. And the black box is often an amalgamation of those overlapping influence systems, right? Which are really hard to describe, but if you can put it into context, it sometimes becomes easier.
So Beth, this might sound like a very nerdy question, but I'm curious what your favorite database is.
So I'm going to go with my favorite database concept, and that is the knowledge graph databases. I like to describe them as people who don't even know what a database is, quite frankly. So they start with their basic understanding of a database, which is maybe an Excel spreadsheet, to a relational database, and then a knowledge graph database. Like, what is that? And why would a graph database even matter? And I tie them into what most people can relate to is when they see how a spy network was uncovered, right? And you see the dots on a frame and there's all these different colored strings. And to a degree, that's what a knowledge graph is doing. But the second piece to that I'd like to share is that the knowledge graph is also something like an antenna. So it's got the multidimensionality where I have a segment, an antenna has multiple segments, and as you pull it up, you actually can reveal these additional segments of that antenna. A knowledge graph, to that point, basically with every segment brings in a whole new set of context that allows you to begin to actually understand the multidimensionality of whatever concept that you're looking at. And this is the part that kind of starts to blow people's minds. They get the antenna part, but it's understanding that depending on the context that you're looking at something, the view of it and everything related to it may be completely different. And so we don't want that to be all on one level. We want to be able to analyze it within context, which is where this huge power comes from. But I'm going to add one more piece to this, because a concept out there that lots of people are talking about, we didn't talk about this earlier, so is data mesh. So what I have found in the concept of data democratization is that for people to go along the journey, we have to allow non-data people to play with data. They have to experience the frustration. They have to experience the insights. They have to dive in and play. But in order to do that, we have to have actually created, I used to call them ponds or puddles. This is now the data mesh concept. We have to create a means through which, within their context and world and some very specific problems, they can have at it. How I've seen that be extremely successful means that there's a fully federated database underneath that actually has all of the guardrails and MDM and everything I apply to it. And then a piece of that is pulled out within context in a way that users who are non-statistical, non-technical can play around and touch and feel this data and see how the world relates to itself, with one caveat. They have to make the promise that they're going to, before they provide any conclusions back out into the world, they're going to take what they found back to the data experts. That means that they're going to walk the data experts through the journey they took with the data. That way, there's a validation that what they've concluded indeed can be concluded. And this is one of the main caveats where we see people not be successful with data democratization, is that we just send them on their way and they're good to go. It's never like that. There has to be these feedback loops so that we can make sure that the real world with the real world evidence and the statistics actually tie into the create context to make good, sound scientific conclusions.
How do you talk about data with corporations, and specifically, how do you talk about AI with corporations and how they might be able to incorporate it or not?
So coming from an IQVIA, which again serves massive scale. I mean, they've been doing that for 70 years, from little surveys 70 years ago through to, probably the second largest integrated data source, maybe even largest integrated data source in the world. So there's a lot of places that have a lot more data, but a lot of that data is usually grown within, right? So being able to take in all this variety of data sources from all over the place and begin to harmonize it, you have to look at a lot. You have to be much more strategic, and to turn it into a commercial product. You have to be much more strategic about what you're taking in, what you're going to keep, how you're going to massage that, and how you're going to integrate all this so that you can over and over again create new value propositions to new customer bases, which isn't that what we all want to do? So now you take that into any kind of organization where data as a product is not their product, right? They're like, I don't need to be like that. I don't need to be that careful with my data. But at the end of the day, if you want to get that incredible value out, you have to be thinking about the foundations of the data that you're bringing in and how strategically you're going to put all of that together. What I have found is that most people who are working in that area can't conceive of data in that way. They don't think big enough about the impact of how these various data sources get together. They're just trying to meet, project deadlines and check boxes and understand within a certain context and not worry about the context beyond. But it's when, and obviously you can't let this go into like forever, but if you can think 1, 3, 5 years out about all the use cases of what you'd want to be able to do, you can actually begin to build the foundations of your data in an extremely connected, transparent, and reliable way so that you understand the various rules that are going to be applied on a certain context. There's a lot of people who are thinking about data like, I want one trusted source. There's no such thing as one trusted source in the way that people think about it, because they're thinking about it as one answer. It's never one answer. It's always one answer in a context, right? But that means you have to walk people through that you need to do that. And if you have people who don't fully understand the complexity of building a foundation like that, they begin to put up more silos. So you hear this whole talk about the various silos being created. It's breaking down those silos to realize that we're aligning on the priorities of an organization, of a company, rather than of individual departments. And that connecting that bigger goal can sometimes mean that in order for a technology to work or an innovation to work, you had to have talked to another group who maybe had to do something first. So if you start to get into single sign-on or variety of identity and consent, etc., you need to have certain technical things and potentially certain human things and capabilities in place to be able to move forward on a particular technical capability. And if they don't talk, that group may move forward on a technical capability and then say, it didn't work. And then they put it to bed and say, that thing doesn't work. But in reality, the thing does work, but you had to do 1, 2, and 3 first. And without that holistic view, we're ending up where now the voice that gets heard is that thing doesn't work, not how do we actually align this in a way that sequencing matters in science and baking, right? Sequencing matters. And so how can you begin to actually get people aware without getting into the heavy details of the sausage making? Because everybody's like, oh, nobody wants to know how the sausage is made. Well, that's true. Nobody except the most technical want to know how the sausage is made. But you do in a sausage factory need to know, are you making turkey sausage or pork sausage? Can you mix the two? Are you making patties or are you making links? Are they going to be in casings or are they not? Will it be sweet or will it be spicy? All of these things are some of the detailed questions that people need to walk through in their decision-making processes that are very hard for organizations to discuss openly, even with each other, right? Because it means you're getting at the heart of their decision-making processes. And back to that, we don't teach decision-making. People don't realize how many decisions they're making all the time.
Right. You gave us a lot of information, which is fantastic. And I think they're thinking through that as we wrap up our conversation today about people who are listening, what would be the first step that you would give folks? What kind of homework would you give our listeners here to get started?
It's actually kind of easy for me because I've thought on this topic for a long time. Like, why are we not making more progress with data? There's so many capabilities out there. I call it the cultural feat, not the feet that you walk on, but like overcoming a feat. FEAT, and that's feedback. You need to be getting feedback as many places as you can. Obviously, within reason, it can't go on forever, but there needs to be feedback from a diversity of thought and experiences about whatever it is that you're trying to do and how these things connect and what the potential impact would be. Those questions that you're going to ask as you're looking for feedback have to be based in empathy. We have to realize that as we ask these detailed questions, we actually begin to hit triggers on people because they may not understand what they're doing and then they don't want to talk about it and then they think they're going to get in trouble. And we need to have empathy for what and why we're asking them to change how they talk about a particular situation. That ties into accountability. We have to do what we say and say what we do. I heard people actually talk about accountability like, oh, young people can't be accountable for XYZ, my new hires. Are you kidding me? Everyone has to be accountable. It's just what they're accountable for grows as they grow in responsibility. And that lands us on transparency and trust. And a big part of that is having the first thought that as people are asking these questions, they have good intention. We often assume that people are trying to uncover or reveal something because they want to get me in trouble or they want to, do something with bad intentions. If we can go on the assumption that it's with good intentions, because as we can be vulnerable with each other in this trust, we actually can lift each other up. A simple example of that, at teams that I worked with, we started with doing peer review, even within the technical area, before we even go out to the others for feedback. And the first step we realized is for 20 years, somebody was doing something in a particular way, and it turned out it was not right. It's not their fault that it wasn't right. They inherited it like that. But without some form of peer review on an ongoing basis, even on some things we thought were old decisions, we can't realize how the world has evolved. We need to talk about those things. And it's not for the purpose of making someone look bad. It's to make your work look better, right? The whole purpose is to make things look better. So that's a lot. That cultural feat is a lot right there. And I hope folks will use that to move themselves and their organizations and lives, their own personal lives. This is all in our personal lives too, move forward as well. And one of the key things that I had to do to ensure my teams while I was at Merck and at IQVIA about innovation is painful. It hurts. And when you're moving forward in spaces where there aren't things that there aren't books written about it, you can't study up on it when things are happening that fast. And that makes people feel very uncomfortable. And so beginning to realize that being comfortable with feeling uncomfortable is a step that we all are going to have to take, because the pace at which everything is moving, the world will be changing, is just going to continue faster and faster and faster. And so once people realize, like I realized as I was leading, a 70-person team, that, oh my gosh, I've been terrified my entire career. Literally, like terrified. I broke out like with rashes and different things because I was so scared about all the things that I was moving forward. And I realized that's what innovation looks like. You couldn't have been doing it wrong. You're taking the first steps on the moon. All right, maybe not the moon, but you get the idea. And so everyone feels uncomfortable because they're doing those things for the first time too. And that's the way it feels. There's no getting past that. And so once they realize they're not alone in that feeling, well, suddenly it's okay. And so potentially creating little communities, which is where Communities Connected actually comes from too, right? But it doesn't have to be just from that organization, any communities where you can share about how scared you are about moving forward in different spaces, because they can either do one of two things: provide you comfort because they have knowledge in those spaces. They could share with you blind spots that you weren't thinking about, or they can actually be the motivation that pushes you forward because they see that you're actually doing the right thing. And so being able to create these various communities that can provide insights on the different facets of the innovation is really empowering.
Thank you, Beth. Thank you so much for being on the show. I have learned a lot, and I think the listeners have learned a lot. We really appreciate everything that you're doing in this space. And I also really appreciate talking to someone who has ties to Pittsburgh. So always glad to talk to another person who loves Pittsburgh. Thanks everyone for tuning in and for following the show. The Health and Explainable AI podcast is produced by the University of Pittsburgh's Health and Explainable AI Research Laboratory at University of Pittsburgh School of Health and Rehabilitation Sciences Department of Health Information Management. I'm Jordan Gass-Poore. Thanks for listening.